Hello again everybody. Apologies for not posting a video recently, but things have been hectic all summer and suddenly here we are in October and there are Christmas things in the shops. It's crazy. I've been to a couple of conferences recently. The first one was in Rome at the International Society for Technology and Arthroplasty, ISTA. It's its annual meeting. I talked about it in a previous video. I've been to this conference several times over the years. First time was in Seoul in 2006. More recently I was on the faculty in Kyoto. That was an amazing meeting in a beautiful city. At the Rome meeting, I submitted the poster which summarised the results of the body composition analysis that I've been doing for the last year on my patients. I'm not sure anybody took any notice of it, but it was good to see so many old friends and colleagues at the meeting. The highlight for me was a session on hip resurfacing. Things are getting really interesting here. The MatOrtho ReCerf is now available, and Justin Cobb's H1 ceramic resurfacing will soon be cleared for use. Professor Cobb asked me to speak at his London conference a couple of weeks ago. It was a really good meeting and the excitement about the renaissance of hip resurfacing was palpable. Derek McMinn, the inventor of the Birmingham hip and my old tutor, was there, and so was Dr. De Smet from Ghent, who's been involved in hip resurfacing for nearly 30 years. I guess I've been around nearly that long as well. A lot of the younger surgeons seem to be interested in learning how to do hip resurfacing, so it's going to be up to us veterans to teach them how to do it properly. I'll never be able to retire. Talking of which, I sometimes wonder when I actually will hang up my scalpel and head for the hills. It's a question a lot of us more, say, senior surgeons ask ourselves. 20 years ago, most of the older surgeons would retire as soon as they could. I suppose they could afford to as well. But these days, there are a lot of us keeping going. I'm not surprised, really. I feel so lucky to have been a hip surgeon during the last 25 or more years. I was one of the first to be a super specialist in hips. I've never done anything else really since I became a consultant. It's a wonderful operation to do, and I just love looking after my patients and helping them through their journey back to a hopefully pain-free and more active life. We've seen an explosion in new technology, what with resurfacing, 3D printed implants, robotics, and now AI and machine learning. Hip surgeons are an interesting bunch. We all seem to love what we do, despite being a bit, well, to put it kindly, on the spectrum. I was speaking to a Belgian surgeon over dinner in Rome, and we both agreed that we have a strong streak of OCD when it comes to surgery. I think that's probably a good thing. Some people ask me why I just don't retire and relax. The answer is, I'm not ready. I feel fitter and stronger than I've ever been. I work 3 days a week and I pace myself. I've got a great team at work, and together we do a fantastic job. We also have lots of fun. The money comes in handy as well, as my youngest has just started university. I love my job. It gives me freedom and opportunities that I wouldn't have if I were retired. After all, if I were retired, I wouldn't be making these videos. I had a notification recently that there have been 750,000 views of my videos. I'm amazed and I'm delighted. Thanks to all of you for watching and supporting my channel. Let me know in the comments if you've got any questions or an idea for a video, and I'll see you all again next time. Thanks for watching.